Do you have any of these? 13 hidden skin signs that reveal diabetes. Welcome back to Medical News Pulse, where we bring you the latest breakthroughs in medical science and health awareness. Today, we're exploring a fascinating aspect of diabetes detection that could potentially save millions of lives worldwide: the ability of our skin to act as an early warning system for this silent epidemic. Diabetes affects over 537 million adults globally, yet nearly half of these cases remain undiagnosed until serious complications develop. What if I told you that your body's largest organ, your skin, might be trying to tell you something crucial about your metabolic health long before traditional symptoms appear? Today, we're diving deep into 13 distinct skin manifestations that can serve as early indicators of diabetes, potentially revolutionizing how we approach diabetes screening and prevention. The relationship between diabetes and skin health represents one of the most underutilized diagnostic tools in modern medicine. While healthcare providers traditionally focus on classic symptoms like excessive thirst, frequent urination, and unexplained weight loss, dermatological manifestations often precede these more obvious signs by months or even years. Understanding these cutaneous clues could dramatically improve early detection rates and prevent the devastating complications that arise from delayed diagnosis. Understanding the skin diabetes connection. To comprehend why diabetes manifests through skin changes, we must first understand the profound impact that elevated blood glucose levels have on our body's largest organ. The skin, weighing approximately 8 pounds in the average adult and covering nearly 20 square feet of surface area, serves as far more than a protective barrier. It functions as a complex ecosystem of blood vessels, nerve endings, immune cells, and specialized structures that are all vulnerable to the metabolic disruptions caused by diabetes. Chronic hyperglycemia, the hallmark of diabetes, triggers a cascade of pathological processes that directly affect skin health. High glucose levels lead to the formation of advanced glycation end products, which are harmful compounds that damage proteins throughout the body, including collagen and elastin fibers that provide skin structure and elasticity. This process, known as glycation, accelerates aging and impairs the skin's ability to heal and maintain its barrier function. Additionally, diabetes compromises the microvasculature, the tiny blood vessels that nourish skin tissue. Poor circulation resulting from diabetic vascular disease reduces oxygen and nutrient delivery to skin cells, creating an environment conducive to various dermatological complications. The immune system also becomes compromised in diabetes, making the skin more susceptible to infections and slower to heal from minor injuries. Necrobiosis lipoidica, the telltale shin patches. One of the most specific skin manifestations associated with diabetes is necrobiosis lipoidica, a condition that affects approximately 1% of diabetic patients but occurs in over 90% of cases in association with diabetes. This distinctive dermatological finding typically presents as well demarcated, reddish-brown patches that gradually develop a yellowish center, most commonly appearing on the anterior shins. The pathophysiology of necrobiosis lipoidica involves a complex inflammatory process that damages the deep layers of the skin, particularly affecting collagen bundles and blood vessel walls. The condition begins as small, raised, reddish nodules that slowly expand and flatten over months to years. As the lesions mature, they develop a characteristic appearance with a waxy, yellowish center surrounded by a raised, reddish-brown border. What makes necrobiosis lipoidica particularly significant from a diagnostic standpoint is its strong association with diabetes, especially type 1 diabetes. While the exact mechanism linking this skin condition to diabetes remains unclear, researchers believe that immune-mediated damage to small blood vessels plays a crucial role. The presence of these lesions should prompt immediate diabetes screening, as they often appear years before other diabetic complications become apparent. The clinical significance extends beyond mere diagnosis. Necrobiosis lipoidica lesions can become ulcerated, particularly with minor trauma, and heal very slowly due to the underlying vascular compromise. This poor healing capacity makes these areas particularly vulnerable to secondary bacterial infections, which can be serious in diabetic patients with compromised immune function. Acanthosis nigricans, the dark herald of insulin resistance. Acanthosis nigricans represents one of the most recognizable and clinically significant skin manifestations associated with diabetes and insulin resistance. This condition presents as dark, velvety patches of skin that typically develop in body folds and creases, including the neck, armpits, groin, and sometimes around the eyes or mouth. The underlying mechanism involves elevated insulin levels, which occur as the body attempts to overcome insulin resistance, a key feature in the development of type 2 diabetes. High insulin concentrations stimulate keratinocytes and dermal fibroblasts through insulin-like growth factor receptors, leading to the characteristic hyperpigmentation and hyperkeratosis that define this condition. From a clinical perspective, Acanthosis nigricans serves as an easily identifiable marker for metabolic dysfunction. The presence of these darkened patches often indicates not only insulin resistance but also an increased risk for cardiovascular disease, polycystic ovary syndrome, and certain malignancies. The severity and extent of Acanthosis nigricans often correlate with the degree of insulin resistance, making it a useful tool for monitoring metabolic health over time. Early recognition of Acanthosis nigricans is particularly important in pediatric populations, where it may be the first visible sign of developing insulin resistance and future diabetes risk. Children and adolescents with this condition should undergo comprehensive metabolic evaluation, including glucose tolerance testing and cardiovascular risk assessment. Xanthelasma, cholesterol deposits revealing metabolic chaos. Xanthelasma palpebrarum manifests as yellowish, cholesterol-rich plaques that typically appear on the eyelids, particularly near the inner corners. While these lesions can occur in individuals with normal cholesterol levels, they are significantly more common in people with diabetes and dyslipidemia, conditions that frequently coexist and compound cardiovascular risk. The formation of xanthelasma involves the accumulation of lipid-laden macrophages in the dermis, creating the characteristic yellow appearance. In diabetic patients, these deposits often indicate poor glycemic control and concurrent lipid abnormalities, which together dramatically increase the risk of cardiovascular complications. Research has demonstrated that individuals with xanthelasma have a significantly higher prevalence of coronary artery disease, myocardial infarction, and ischemic heart disease compared to those without these lesions. In diabetic patients, the presence of xanthelasma should prompt aggressive management of both glucose levels and lipid profiles to reduce cardiovascular mortality risk. The clinical assessment of xanthelasma requires careful examination to distinguish it from other eyelid lesions and to evaluate the extent of lipid deposition. While these lesions are typically asymptomatic, they can cause cosmetic concerns that impact quality of life, and their presence warrants comprehensive metabolic evaluation and long-term cardiovascular risk modification strategies. Diabetic hand syndrome, when skin stiffness tells a story. Diabetic hand syndrome, also known as diabetic arthropathy, represents a unique manifestation of diabetes that affects the hands and fingers through skin and connective tissue changes. This condition involves progressive thickening and tightening of the skin over the fingers and hands, leading to joint stiffness and reduced mobility. The pathophysiology involves accelerated collagen cross-linking due to chronic hyperglycemia, resulting in non-enzymatic glycation of collagen fibers. This process creates advanced glycation end products that make collagen more rigid and less flexible, ultimately leading to the characteristic waxy, tight appearance of the skin and restricted joint movement. The diagnostic hallmark of diabetic hand syndrome is the inability to completely flatten the palms together in a prayer position, known as the prayer sign. This simple clinical test can be performed in any healthcare setting and provides immediate information about the presence of this diabetic complication. The condition typically affects both hands symmetrically and progresses slowly over years. From a clinical management perspective, diabetic hand syndrome often correlates with other diabetic complications, particularly retinopathy and nephropathy. Its presence suggests long-standing or poorly controlled diabetes and should prompt comprehensive screening for other diabetic complications. While the condition itself is not life-threatening, it can significantly impact daily activities and quality of life. Diabetic foot ulcers, the convergence of multiple pathologies. Diabetic foot ulcers represent one of the most serious and costly complications of diabetes, affecting up to 25% of diabetic patients during their lifetime. These wounds result from a complex interplay of diabetic neuropathy, peripheral vascular disease, immune dysfunction, and biomechanical abnormalities that create the perfect storm for tissue breakdown and poor healing. Diabetic neuropathy plays a central role by eliminating the protective sensation that normally alerts individuals to minor injuries or pressure points. Without this warning system, patients may continue walking on damaged tissue, leading to progressive breakdown and ulcer formation. The loss of autonomic nerve function also reduces sweat production, leading to dry, cracked skin that is more susceptible to injury. Peripheral arterial disease, common in diabetic patients, severely compromises blood flow to the feet, reducing oxygen and nutrient delivery essential for wound healing. This vascular insufficiency, combined with the metabolic effects of hyperglycemia on cellular function, creates an environment where even minor wounds can become chronic, non-healing ulcers. The immune system dysfunction associated with diabetes further complicates wound healing by impairing the inflammatory response necessary for tissue repair and increasing susceptibility to bacterial infections. Once infected, diabetic foot ulcers can rapidly progress to deeper tissues, potentially leading to osteomyelitis, sepsis, and the need for amputation. Infectious complications. When the skin's defenses fail, diabetic patients experience a significantly higher incidence of skin infections due to the immunosuppressive effects of chronic hyperglycemia. High glucose levels impair neutrophil function, reduce complement activity, and alter cytokine production, creating an environment where both bacterial and fungal pathogens can thrive. Candidiasis, particularly in intertriginous areas such as the groin, axilla, and under the breasts, occurs frequently in diabetic patients. The combination of elevated glucose levels in sweat and urine, along with the warm, moist environment of skin folds, creates ideal conditions for Candida albicans proliferation. These infections often present as red, inflamed areas with satellite lesions and can become chronic if blood glucose levels remain poorly controlled. Bacterial skin infections, including cellulitis, impetigo, and folliculitis, also occur more frequently in diabetic patients and tend to be more severe and persistent than in non-diabetic individuals. Staphylococcus aureus and beta hemolytic streptococci are common culprits, with methicillin-resistant Staphylococcus aureus becoming an increasingly problematic pathogen in this population. The clinical management of skin infections in diabetic patients requires aggressive treatment and careful monitoring, as these seemingly minor conditions can rapidly progress to life-threatening complications. Prompt antibiotic or antifungal therapy, combined with optimization of glucose control, is essential for successful treatment outcomes. Additional dermatological manifestations. Beyond the major conditions already discussed, diabetes can manifest through several additional dermatological findings that, while less specific, contribute to the overall clinical picture. Diabetic dermopathy presents as small, round, brown spots typically found on the shins, resembling age spots but occurring in younger individuals with diabetes. Eruptive xanthomas appear as small, yellow, waxy bumps surrounded by red halos, typically on the buttocks, shoulders, arms, and legs. These lesions are associated with very high triglyceride levels and poor diabetic control, often appearing suddenly when glucose levels are severely elevated. Bullosis diabeticorum, or diabetic bully, represents a rare but distinctive finding characterized by spontaneous blister formation, typically on the feet and legs. These painless blisters can range from small vesicles to large bulli and often occur in patients with long-standing diabetes and multiple complications. Granuloma annulare, while not exclusive to diabetes, occurs more frequently in diabetic patients and presents as raised, reddish or skin-colored bumps arranged in a ring pattern. The lesions are typically asymptomatic but can be cosmetically bothersome and may indicate suboptimal glucose control. Diagnostic implications and clinical significance. The recognition of these dermatological manifestations carries profound implications for clinical practice and patient outcomes. Healthcare providers across all specialties, not just dermatologists and endocrinologists, should be familiar with these skin signs as they often present in primary care settings, emergency departments, and specialist clinics. When one or more of these skin findings are identified, immediate diabetes screening is warranted, including fasting glucose levels, hemoglobin A1C testing, and possibly oral glucose tolerance testing. Early detection through dermatological clues can prevent or delay the onset of serious diabetic complications, including cardiovascular disease, nephropathy, retinopathy, and neuropathy. The presence of multiple skin manifestations often indicates more advanced diabetes or poor glycemic control, necessitating comprehensive evaluation for other diabetic complications. This includes ophthalmologic examination for retinopathy, kidney function assessment for nephropathy, neurological testing for neuropathy, and cardiovascular risk stratification. Patient education about these skin signs is equally important, as individuals who understand these warning signals can seek medical attention earlier and participate more actively in their diabetes management. Regular skin self-examination should be incorporated into diabetes self-care education, particularly for patients at high risk for foot complications. Treatment and management strategies. Management of diabetes-related skin conditions requires a multifaceted approach that addresses both the underlying metabolic dysfunction and the specific dermatological manifestations. Optimal glycemic control remains the cornerstone of treatment, as many skin conditions improve significantly when blood glucose levels are well controlled. For specific conditions like Necrobiosis Lipoidica, treatment may include topical or intralesional corticosteroids, though results are often limited. Acanthosis Nigricans typically improves with weight loss and improved insulin sensitivity, sometimes dramatically so with successful diabetes management. Xanthelasma may require surgical removal for cosmetic reasons, but addressing underlying lipid abnormalities is essential to prevent recurrence. Diabetic foot care deserves special attention, requiring daily inspection, appropriate footwear, prompt treatment of minor injuries, and regular podiatric evaluation. Professional wound care for diabetic ulcers often involves debridement, specialized dressings, pressure offloading, and aggressive infection management. Preventive strategies play a crucial role in reducing the incidence and severity of diabetes-related skin complications. This includes maintaining optimal glucose control, regular skin hygiene, appropriate moisturization, sun protection, and prompt attention to any skin changes or injuries. Psychological and social impacts. The psychological impact of visible diabetes-related skin conditions should not be underestimated. Conditions like Acanthosis nigricans, Xanthelasma, and chronic ulcers can cause significant emotional distress, social anxiety, and reduced quality of life. Healthcare providers must address these concerns with empathy and provide appropriate support and counseling resources. The stigma associated with visible skin conditions can also affect treatment adherence and healthcare-seeking behavior. Patients may delay seeking care due to embarrassment or fear of judgment, potentially leading to delayed diagnosis and worse outcomes. Creating a supportive, non-judgmental healthcare environment is essential for optimal patient care. Educational initiatives targeting both healthcare providers and the general public can help reduce stigma and improve recognition of these important diagnostic clues. Public health campaigns emphasizing the connection between skin health and diabetes could potentially improve early detection rates and reduce the burden of undiagnosed diabetes. Future directions and research opportunities. Ongoing research into the molecular mechanisms underlying diabetes-related skin changes may lead to new therapeutic targets and improved treatment options. Advanced imaging techniques, including dermoscopy and reflectance confocal microscopy, may enhance our ability to detect and monitor these conditions. Artificial intelligence and machine learning applications are being developed to automatically recognize diabetes-related skin changes from photographs, potentially enabling widespread screening through smartphone applications and telemedicine platforms. These technological advances could democratize access to diabetes screening, particularly in underserved populations. Biomarker research is exploring whether specific proteins or metabolites present in skin samples could serve as early indicators of diabetes risk, potentially leading to non-invasive screening methods. These approaches could complement traditional blood glucose testing and improve our ability to identify at-risk individuals before clinical diabetes develops. Conclusion: the skin serves as a remarkable window into our metabolic health, offering valuable clues about diabetes risk and progression that are visible to the trained eye. These 13 dermatological manifestations represent an underutilized diagnostic tool that could revolutionize diabetes screening and prevention efforts worldwide. As healthcare providers and informed patients, we must recognize the profound importance of these cutaneous signs and incorporate them into routine health assessments. Early recognition of these skin changes can lead to earlier diabetes diagnosis, more timely intervention, and ultimately better patient outcomes. Remember that while these skin signs can be highly suggestive of diabetes, they are not diagnostic in isolation. Any concerning skin changes should prompt professional medical evaluation and appropriate testing. The goal is not to create anxiety but to empower individuals with knowledge that could potentially save their lives or significantly improve their health outcomes. Thank you for joining us on Medical News Pulse for this comprehensive exploration of diabetes-related skin manifestations. If you found this information valuable, please subscribe to our channel and share this knowledge with others who might benefit. Early recognition saves lives, and your awareness could make the difference for someone you care about. Until next time, stay informed, stay healthy, and remember that your skin is always telling a story. We just need to learn how to listen. Don't forget to like and subscribe if you found this video helpful.